Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Welcome to Early Intervention Matters. Imagine you're a mother in Lagos. Your 2-year-old isn't speaking yet. He doesn't respond. When you call his name, he doesn't respond. He lines up his toys in the same order every single day and evening. He screams if things are moved. You take him to the clinic. You're told he's a boy. He'll talk when he's ready. You take him to your mother. She says to you, this child needs prayers. You take him to your pastor. He says, there's a spirit on this child. And somewhere in the middle of all that, you, the mother, you're left completely alone. You're carrying a weight you cannot name for a child you cannot yet reach. This is not a rare story. This is happening every single day in Lagos, in Abuja, in Kano, in Port Harcourt, and in countless Nigerian homes across the diaspora. So today, in Early Intervention Matters, we're actually going to talk about this. We're going to name it. We're talking about what it means to raise a neurodivergent child in Nigeria, in Africa. We're talking about the barriers, the stigma, the silence, and most importantly, what hope actually looks like on the ground. So I'm Dr. Inyang Takon. I'm a consultant neurodevelopmental pediatrician, and I'm the host of Early Intervention Matters. I've been in practice in the UK for over 2 decades. And joining me today is a woman who has dedicated her career to making sure no Nigerian parent has to face this alone. I'm so pleased to introduce you to Dr. Gbemisola Boyede. She's a neurodevelopmental pediatrician. She's a pediatrician as well. She trained with similar backgrounds to me in Africa. She's got a lot of experience, and she is somebody who is very passionate about children's well-being, children's development. And we're going to be talking about this important topic today. Although I didn't meet Dr. Boyede when she was training, obviously I'm more senior in the profession, but Dr. Boyede and I did some collaboration when we were both organizing a neurological conference in Nigeria. Although we were both in the UK, we were doing this collaboratively with pediatricians in Nigeria. And this alone shows you how, despite the fact that we both moved away from our original place where we were working and trained, we're still passionate about making sure that things are right for children in Africa, in Nigeria. And that's why we feel we need to discuss this. We need to have a proper conversation. So thank you so much, Dr. Boyede, for joining us to have this conversation. And I'm looking forward to the discussions because I know you're very active doing a lot of things. And we're going to be sharing your experience, your journey, and what we can do collaboratively for children in Nigeria. So please, can you introduce yourself to our audience?
Okay, thank you, Dr. Takon, for having me. I think it's a privilege to be on this platform. I am Gbemisola Boyede, and like you rightly said, I am a pediatrician from Lagos, Nigeria, currently in the UK. and I've been in pediatrics for also a couple of decades now. So it's a pleasure to be here today. Thank you.
Thank you. Thank you for joining us and giving us a bit about yourself. So can you tell us about your journey? People usually ask me, what drew me to pediatrics? So what drew you to pediatrics and how did your career unfold in Nigeria and up to the point that you moved to the UK?
Okay, thank you. So I did my undergraduate in the University of Lagos and also did my house job. That's the internship at the Lagos University Teaching Hospital. And during the time of doing my internship, I just fell in love with pediatrics. I love the fact that children do not pretend. When you are the house officer, you are the one going around doing everything after all the decision have been made. And I noticed that for the adults, most times, they just keep complaining about the same thing over and over. It's almost like you're doing nothing for them. But when you go to pediatrics, you see them bring a child, and then within a few minutes, you've done something. Maybe this is a child who is almost dying, and maybe because the child was anemic, no blood, and you just give a blood transfusion. And by the end of that day, that same child is running around the world playing. So I really always feel the impact. I love the fact that children, once you get the right intervention, you can see the impact almost immediately. So I love that about pediatrics. So that is what drew me to pediatrics. So right from my house job period, I was planning to go into pediatrics. I studied for my primaries and did my primaries immediately during my youth service. So then I came back to do pediatrics training. So that's what drew me to pediatrics generally.
That's very similar to me. I fell in love with pediatrics during my house job. I just used to enjoy. Sometimes I'll just go and stand on the windows and be watching the children in the incubators and I just
Mhm.
loved watching their different moves and they've had personalities from the very beginning and it's just interesting that we both have similar stories about how we fell in love with pediatrics and I've never regretted it and I'm sure you haven't as well,
Yeah.
being
It's
a pediatrician. Yeah. So when did you start getting interested in neurodevelopmental conditions?
So I came back to Lagos University Teaching Hospital to do my residency training as well. And then I finished, but towards the end, when you are the senior registrar, you are allowed to pick a unit to stay as that's your interest. So when I was a senior registrar, I started developing interest in pediatric neurology. So I stay longer in pediatric neurology more than any of the other units that we rotated through. So I was a long time serving with pediatric neurology, and that is where my interest for neurodevelopment, because neurodevelopmental pediatrics at that time was really a relatively young subspecialty, kind of coming out of psychiatry, psychology, and coming together then. So I was just so interested in knowing more. Of course, when we're doing neurology in Nigeria, it's not like here in the UK where you have separate like community pediatrics, separate from pediatric neurology. We do everything. So anything, as long as it's brain related, going to end up with us in neurology clinic anyway. So that is where I begin to see a lot of children with these neurodiverse conditions, and I begin to learn more about it. And then when the opportunity came for me to do subspecialty training, I decided to go for developmental pediatrics. So that is how I find myself here today. Yeah.
Gosh, we have such similar stories as well. I did my postgraduate training in Louth as well, the same place where you trained, and I was in neurology as well when I then became interested in neurodevelopmental conditions. And just like you, there was nothing formal there, which is one of the reasons why I really wanted to come out and train because I was so interested in it. And I remember doing my dissertation, I refused to do anything related to acute pediatrics. So I went out to the community to see children. So it's quite interesting. So it just shows how, both of us have had the same passion for children with developmental conditions.
Yeah.
Great. So when you were there doing neurology and training, did you see children with neurodevelopmental disorders at that time?
Yes, there were lots of them. In fact, my dissertation as well was also on cognitive assessment of children with HIV, because also that was also a period we have a lot of HIV was lot then, and we are doing a lot of researches around HIV. So I was interested in the neurodevelopment at that time. So I did my dissertation on cognitive assessment of HIV infected children, comparing them to the HIV seronegative children. So those are the things that also kind of feel my interest to learn more. So because of that, I have to work with some psychologists and some tools, how to use that developmental assessment tools. So that is where I begin to get more interested. So we've always had these children with neurodivergent conditions, even as at that time, and we were managing them. Sometimes because we don't have a lot of tools on how to support them, we do a lot of collaboration with our colleagues in CAMS, our clinical psychologists, and we obviously do the best that we can at that time. So there were quite a lot of them, even as at that time. But by the time I came back after my subspecialty training, then I realized that some of the children that were not even properly assessed or diagnosed before, we were now able to reassess them, so to say, and then give them the right diagnosis and support. Yeah. But we have quite a lot.
That's really good. And you talked about your subspecialty training. Where did you do your subspecialty training, and when did you come over to the UK?
Okay, so I finished my residency in 2010. So then I did a little bit of being a general consultant pediatrician at 2 private hospitals. Then I got there's what we call African Pediatric Fellowship Program. I don't know whether
Yes.
you've heard of it.
Yes.
APFP. So APFP is based in South Africa. Red Cross War Memorial Children's Hospital and University of Cape Town. They are the one that organized that program. Their vision is to train specialists for Africa, because they also realize that we don't really have a lot of subspecialties training in most of the African countries. In fact, we are even better in Nigeria. At least we have general pediatrics. So there are even some African countries that don't even have the general pediatrics training that will affect the children. So they are into training pediatricians to become, subspecialists or super specialists for different areas. So so I saw the adverts for, I applied. So I applied for developmental pediatrics. That was in 2011. Then I went to South Africa in 2012, February 2012. So I did my postgraduate, they call it postgraduate registrar in developmental pediatrics. And at the same time, you must do a master. So I was also doing my master of philosophy in developmental pediatrics, University of Cape Town. So I was in Cape Town for 18 months, 2 years thereabout, to do my developmental pediatrics. So I was sponsored by the African Pediatric Fellowship Program of the University of Cape Town. Red Cross War Memorial Children's Hospital is the largest children's hospital in Africa. It's a quaternary hospital. Everything
Okay.
is in Red Cross. So that is why I did my training and then came back to Nigeria 2013, end of 2013, after I finished my training. It's a 2-year program, 18 months to 2 years program.
That's great. So when did you come to the UK?
I came to the UK in 2018. So
Okay.
after I finished my training, I was in Nigeria for at least 5 years before I
Okay.
came to the UK in
So
2018.
that's quite good. So you were able to transfer a lot of those experience down to, to the children in Nigeria. That's really good.
Yes, I did.
That's really good, and I'm really pleased to hear that, because, as you said, there was no formal training in Nigeria. So for you to go and get that training and the experience, that was really great. Good. So can you what kind of barriers did you see in terms of the assessment, or first of all, picking up the children? And obviously it's not everyone that was skilled in the assessment. What
Sure.
were the barriers that you saw? Yeah. 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 Okay. That's absolutely right. Okay. Good. So that's interesting, Bami, and I'm really pleased to see that things had moved on by the time you left. So I left. I came over to the UK in '99 when I got scholarship to come in and do my master's in community pediatrics at the University of London, which is where I was introduced to neurodevelopmental conditions and neurodisability. So before coming, there was absolutely nothing existing in terms of formal training or recognition. And what used to be quite interesting was the children, when we were doing the follow-up clinics in the hospital for children who were discharged from neonatal unit, we would see these children who were hyperactive and, having difficulties, but we couldn't really do anything for them. And we would see the, parents struggling to handle them. There was no trained professional. And even we as clinicians did not have the skills to manage them. And I think that those kind of experiences stuck in my mind. And I knew, theoretically that children who have gone through these difficulties would have complications. But what we didn't have was the skills or the pathway. We didn't even have the collaboration. So I'm really pleased that you were collaborating with other people, with the psychology, you were really reaching out to other departments. We didn't have that when I was training. And so these are the things that and I used to read. Used to try to read and see what was going on in other places. So it was quite interesting when I saw they can do so many things for children, and I was so drawn to developmental pediatrics. And that's one of the drivers that really brought me out to say I needed to go out. So I was really looking for all opportunities, and that's how I came out to do my master's from the scholarship funding from World Bank when I came on. And so it's quite interesting and also quite a positive development to see that, by 2013, things had started moving on. You could do all this collaboration with people. You could get assessments done. It just warms my heart and gives me hope that we can actually do things. But it's interesting that the same zeal for you to go and get more training was there, and that's what got you out of Nigeria to go and get more training. And just for professionals who are listening and hearing us, hearing this conversation, I think there's a lot that we as professionals can do in terms of trying to get the skills and the training to help us be able to support children better. Because once we're able to identify their needs, we can support them better. And, Dr. Boyede is a great example of that. And there are many more pediatricians who have since come out and are getting those skills. So well done to you for doing that. So since you've left, I think before then, can we talk about how the parents were receptive to when you told them there were developmental difficulties? Because you and I know from our cultures, these are not things that are readily accepted. So how did you used to approach that with families when you told them that there were differences? Yeah.
Yeah. Okay. So one of the in Nigeria, the challenge most of the time, number one, parents who don't have very challenging children, who don't have severe cases, don't even want to come to the hospital. They just take it as something they just need to deal with as education or discipline. They don't even want to look at it as a problem to start with. But obviously for parents who have very uh, severe end of the spectrum kind of children who are nonverbal, who have a lot of behavioral issues, they really are more receptive because they want help. So those are the ones that we tend to see first in our clinics. Those are the ones that the parents have gone to everybody and then they get referrals. So just to start by saying, I was working in a tertiary hospital. So I was working in the leading teaching hospital in Nigeria, in Lagos, Nigeria at that time. So definitely I see all the children who are referred down for those kind of conditions. And then initially, because there was nothing, all the children come to neurology and sometimes they don't get anything. Parents are disappointed. But when I came back, obviously people begin to know that now we have somebody with neurodevelopmental pediatrician trained. So even colleagues were now beginning to send children down to me to see in my clinic. I'm just going to talk about the challenges about how they, but because you're asking about the parent reception, it goes both ways. Some parents are actually looking for answer. So they want to know what is it that is causing this problem, what is wrong with my child? Why is my child not able to do this? I feel like it is easier if they also have other children who are neurotypical, so they can see the difference. So
Different.
they can see the differences. So those parents are more they accept the diagnosis better. And then the next question obviously is, what do I do? How do we help the child? And then we begin to talk about solutions available. Let me just say that even in the tertiary hospital, we were not having all the support. When I was in Luth, then we have only one speech therapist, just one speech therapist for the whole of the hospital. And I'm talking whether you have stroke, whether you are child, whether you're an adult, whether you are anything. You can imagine that, just one speech therapist for the whole of the hospital. But one good thing I noticed that some Nigerian parents are very proactive. Nigerian parents tend to find solution, and I think that is one good thing I think I learned from Nigeria, that we always want to get the answers. So parents always don't sit. So I found some of the parents begin to research for themselves what is the solution for my child, and some of those parents themselves started therapy centers. So we have places like Child Development Center. I don't know whether you know of the late Dr.
Yes,
Akindayomi.
I can do.
Yeah,
Yes.
she had a child with autism, and then she
Yeah.
started the CDC. She had speech therapy. She had
Yes. You have.
physiotherapy, occupational therapy. So CDC was a very big blessing, and luckily it's closer to Luth. Then we also have places like Patrick Center, Mrs. Akonde. She also had a child who was on the spectrum. She also started a place. Most of these parents started because these were actually, to be fair, parents were a little bit more privileged, so they have access to travel, they know what is available. So some of them have taken their children abroad, brought them back to have their diagnosis, and they know what is available. So, but obviously not available at home. So some of them started those centers, and that is how so we have a lot more resources in the private sector in Nigeria at that time than even in the
Okay.
government hospital. But the good news is that I was able to collaborate with some of them. So I did a lot of collaboration with Dr. Akindayomi. Some of the parents, because obviously these things are expensive. Money, financial is a major challenge. So some of the
Yes.
parents who have the money, they can pay the fees. Because at that time, even for those organizing private, it's so expensive for them to maintain, the staff and all the resources that are involved. But then we now know that there are also families who cannot afford those fees. So Dr. Akindayomi
Yeah.
had what we call a sliding rule. So we had some collaboration where she will offer those parents maybe once a week therapy and teach them things they can do at home, even give them a little bit of adapted low-cost technology of toys and stuff that they can use to do some therapies with their children. And she was charging them something very cheap there, maybe 5,000 a week. So we were doing that kind of a thing. That is how we're supporting our families. I don't have a speech therapy in Luth. We have occupational therapy. We have the occupational therapy, maybe 2 or 3 of them, but at least we have something occupational therapy, but they're also for the whole of the hospital, both adults and children. Then the only thing we really have good is the physiotherapy. So our children with cerebral palsy, they are very good, even though there are so many of them and they can only do maybe once a week or once every month therapy, which is, insufficient, but at least
Yeah.
physio is
Better than
there.
nothing.
It's better than nothing, but we have absolutely nothing for speech, next to nothing for OT, next to nothing for behavior therapy, So, and coming from me, because I came from South Africa, where they have everything. So one of the things I have to do is to do a lot of adaptation. I have to start so many things on my own. I had a lot of challenges doing that, but that is part of the story. I have to reach out beyond people that are in the government hospital. I could just have actually done nothing because it's very easy to do that. I could just be a
It's a
normal
very
general
easy to
physician
do.
earning my salary,
Yeah.
but I wasn't comfortable. Even to start my clinic, it took me a while because I went to the hospital because we usually have the pediatric neurology clinic. I told them I need a day for my developmental clinic where I can do my assessment. They said, "Oh no,
Yeah.
all the clinics are full. There's no space there. Do an afternoon clinic." I said, "I can't do an afternoon clinic for developmental assessment. I have to do it in the morning because the children, I have to see them fresh." So I now realized, okay, fine. I created a clinic out of no clinic. I just find myself in space.
So lots
where
and lots of adaptations and
Yes, so we have to do all that. Then there were no tools to do assessment. I created my own assessment tools. I bought them with my own money. Even when I was living, I left them in Nigeria. I did that for myself. So because that is the only way I can do assessment in my clinic. I have to.
well done, Gbemi.
So it's
Well
a long
done.
story, but I think we.
Well done. And when you were talking about one speech therapist I actually experienced that. So for a couple of years, I was going to Ibadan,
Mhm.
University College Hospital, where I trained from. And I was going there to teach. I used to come in from the UK to go and teach on the Masters in Child and Adolescent Mental Health course. I was teaching the developmental module. And it was one speech therapist as well for the whole hospital. So people would travel from afar. And this is a real problem. So our audience who are listening, this is a very real problem that we've got a big, massive country like Nigeria, where we're having many children with developmental difficulties, and everybody is heading towards the teaching hospital, the tertiary hospital. So in Nigeria, we have the primary care, then we have what's supposed to be like secondary care, and then the tertiary hospitals, which we call the teaching hospitals, where all the specialists are usually based. And most people used to go to those hospitals even from the villages, from outlying places. So imagine the population of children, of families, and as we're hearing, that speech therapist was not just for the children, it was both the speech therapist in the hospital for children and adults. So can you imagine the story that I just started with? My 2-year-old child who wasn't speaking, sitting in a clinic in Lagos, and who needs a speech therapist, but there is no speech therapist because the resources are reduced. And then we think about what the parents who have the means are having to do. So even though they had the means, many of them had to invest, go abroad, and then come back and set up services. So these were some of the huge barriers. And if I just go back to something you said, Bimi, you said that many of the parents who were coming were those ones whose children were quite severe, who had more things. So we're looking at the fact that a lot of the children were not actually coming up.
Yeah, tip of the
So
iceberg.
yeah, so we were only seeing the tip of the iceberg, and even the tip of the iceberg, we couldn't actually meet their needs, which is quite challenging. And as a pediatrician, you mentioned it could have been easy for you to do nothing, but because you were quite invested in, doing something for these children, you reached out, you collaborated with the practitioners in the private sector, you collaborated, you got your things, you were even fighting to get your own clinic to see the child. So people can begin to appreciate all the barriers that's there, that even when there is a willing clinician, there isn't the resources or the enabling areas to be able to do the things. And j- I was just thinking that, so for majority of the families who couldn't have the means, they couldn't access care, and that must have been very you know disabling for some families. Even being able to pay the subsidized fees would have been a chore for them, wouldn't it?
Yes, it is. It was for many of them. Even sometimes, even to do reports. I remember that in Luz, when I've done my developmental assessment, which I don't even charge the families for because I just felt, I don't want them to still have to pay. And then I want to do reports. Luz to say you have to put a fee for your report, then they would double it for the parents. So I told them my fee is zero, so they can double zero and then make it zero. I'm just talking about some of these. It was quite challenging. But
Challenging, yeah.
yeah, but the
Gosh,
good news is that there were. I see that even in the midst of the challenges, there were opportunities. So again, social media began to take place around that time. So it was around about the same time I also started Ask The Paediatricians. So that gives people opportunity to ask questions. So people ask, my child is not able to do this, my child is not able to do that. What do you think? Then you can tell them, oh, can you do this screening? For example, MChat is available online. Go do the screening. If the screening is high, then come. Then some of the, we have a bank, one of the corporate banks in Nigeria, they were, one of their own CSR was, they were interested in autism. So they begin to do a lot of things like creating awareness. And then they were doing that for a couple of years. So I think they do a lot more jamborees. They were always bringing people from overseas, talk a lot about it. People know there's something called autism, but I just feel that we want more for the children in terms of assessment, in terms of therapy, intervention, and all that. Then later on, as the program they started doing that. So they would do like maybe 2 weeks of anybody can come and have their child, have like a kind of a screening form of assessment. And then, of course, they're all going to come up to my clinic. It was those in Lagos because most of the time it was in Lagos. But again, that was also creating awareness. So even some parents that were not worried initially, that I'm talking of those who don't have the severe kind of condition, but because of this kind of created awareness, opportunity to ask questions on social media, some of them begin to realize that, okay, there may be something going on. And then we begin to also have those ones also coming to the clinic. Yeah, so that is how things were
So it was
going.
a lot of hard work. It was. But did you have any support from the government?
Uh, mm, I'm not quite sure I have any support from. But even when I came back, interestingly, because I came back and I think I was about maybe one of the first few trained neurodevelopmental pediatricians that came back to Nigeria. I know there are others that may be trained, but maybe outside the country. I didn't have a job even for a couple of years, I'm telling you. So, because the government couldn't even get me a job and I was so interested in coming and working in a tertiary level. So I was even doing private. So even then, I later got a job as a locum for a couple of years before I finally got um, a full-time post. So most of these things I actually did them while I was actually working as more of a locum doctor with the Lagos University Teaching Hospital.
Wow.
So, but then
Wow.
I just felt I think the most important thing that happened to me in my career is going to South Africa. I saw that things can be done differently. I could see that, oh, this is how things should be done. And so coming back, I couldn't just settle for anything less. I just felt like
Yeah.
I'm able to replicate because they have therapists, they have speech therapists, they have everybody. We do MDTs, we
Yeah.
do all the things. I have little to nothing. But one of the things I came back is that I must make that difference.
Yes.
And I started training. That's another thing I did. I trained a lot of pediatricians, and thank God I got some private organization, one of these food companies who is interested in even though it's a formula company, but they were interested in neurodevelopment and things like that. So they were supporting me. And so we organized a lot of developmental training. So I created another kind of what I call basic developmental assessment training. I want pediatricians, when they see children, to be able to do basic
Yes.
developmental
Screening.
assessment in their
Yeah.
clinic. Because I realized that our curriculum then was deficient, even for our
Yeah.
general pediatrics. There's nothing developmental in it at all. So most
Yeah.
pediatricians don't even recognize a child who is
Yeah.
development. They kind of suspect something is wrong, but they don't know how to do a bit of something like surveillance or screening or even do a proper assessment. So
Yeah.
we did a lot of training from Lagos, Enugu, Port Harcourt, went
Well
to
done.
me all over the place. I even went to Ethiopia as well just to do those kind of training. So
Oh, wow.
a lot of pediatricians started doing their own assessment. I created that bag for them, bag that have like cubes, all
Yes.
those boards, all those little things you can use in your everyday clinic and do
Clinic.
your assessment for gross motor, fine motor, speech and language,
Yeah.
those picture cards, at least you can have an idea what is going on, and then you can now, be able to tell parents, and then you can
Yeah.
now refer them. Then we have to create a list of directories because like I said, we have little to nothing in the government, so we have to create directories of private facilities that are at least doing something. It may not be able to do the best, but at least it is better than nothing.
So you
So
were able to offer that to parents and
yeah,
signpost them to things.
them to where they can get a little bit of resources.
Yes.
So those are what we were
Wow.
able
You,
to do.
you were a real one woman army just doing it. But thank you for doing that, because one of the basic things is for people to identify that there's something wrong, and where there's no identification or people don't know, then it's much more difficult to, so the fact that you were able to train more pediatricians to do that is really useful. And part of the things is, I think that we need to look at training even beyond pediatricians, people, like nursing staff,
Not yes,
community
yes.
workers, because those are a lot of children might not hit the hospital, but they
Mm,
might hit other health facilities in terms
yes,
of,
yes, yes.
being seen. So it's about the way Nigeria is, and Africa in general, where
Yeah.
the numbers are many and the resources are few. So we have to think about how can the person out there in the community recognize
Mm-hmm.
when a child's speech is delayed, and what can they do about it so that they can begin
Mm-hmm.
to, offer some interventions. Yeah, so if we then move on to just talking a bit about the stigma and cultural context, which we know is quite big with everything we do in Nigeria. It's one of the biggest barriers that families face. I know that from my experience in when I did my master's in public health in Nigeria. I did a study in the community just next to Lagos University Teaching Hospital, or Idiaraba. I did a study on how the community manage febrile convulsions. So I went from house to house interviewing families, and it is just so interesting to to see that despite the educational levels, people held certain beliefs. So I know that that was way back when I did that master's.
Yeah.
What do you think? What was your experience, especially when it had to do with neurodevelopmental conditions?
Yeah. The stigma was still there. A lot of parents try to hide their children away. And one of the things I would say that for us in Nigeria, we tend to pick the children late. We don't, so sometimes I'm doing assessment in children who are 8 years old, 9 years old, one, in UK, you see 2, 3 year old, coming to you. No, most of the time, the parents, they are always open and open that something will, the child will just suddenly improve. So sometimes they don't even seek help on time. So, and then for those who have the older children, sometimes they hide them away. They don't want people to know about their children, because of, then, these religious beliefs that maybe it's a spiritual attack, maybe it's witchcraft, maybe the children need to go for deliverance. The other day I was still reading on social media that a woman, I mean, people talk on social media so you can see what they actually have in their mind. That, oh, if you have snake children, they ruin their families, they impoverish the parents. What is she referring to as snake children? We're talking about children with cerebral palsy, children who have, who cannot walk and all that, who have severe motor difficulties. And she was saying it that, Lord, they told them to go and abandon the child, go and leave the child alone, so that you can move forward. So she more or less was admitting to killing a child on social media, and she wasn't even feeling bad about saying that. And then this is 2026. So you can imagine that. But on the other hand, a lot of parents again who have these children who have children with neurodivergence or other neurodevelopmental conditions, they've started groups, support groups, which is another thing that I think I began to enjoy. So we have parents who have started support groups for their children. And because of that, they now help other parents to understand that you are not alone. And then it's easier for parents to stand with a group. So we have, I know there's Noya started a CP center. She does a lot of work with children with cerebral palsy, and they do a match, they will work for cerebral palsy. I know there's AVM started, Benola CP. It's also
Yeah.
a lot of, so there are lots of all those groups, Super Parents Foundation as well, which were helping the parents. And thank God for social media, because people now come online and talk about their child who is neurodivergent, I think it's helping other parents to realize you are not alone. So the stigma is beginning to drop. I know we are not where we should be, where people can proudly identify with children with disability, but I would say it's much, much better. People talk more openly about it, unlike before, where they actually we hide the children away. Because I remember growing up, and remember some children that we don't see outside because their parents don't cook them up. It is now that I'm a developmental pediatrician and I'm looking back and I remember those children that have condition, but the parents don't take them to church. They don't take them anywhere. They lock them on in the house every day, and you always wonder why. But now I know it's because of the stigma. But I think it's better.
Absolutely. It's lovely. And I can, I think it was a couple of weeks ago, there was a young girl coming out and talking about her ADHD. She's had an ADHD diagnosis and she was talking about it.
Yeah.
And, I had to say, well done for coming out to talk about this, because it's not easy for you to come out on social media and talk about this. On the other hand, there was another day, I'm quite vocal on social media now. So if I see somebody saying anything that is wrong about neurodiversity, I go in there straight away, So on the other hand, there was a family, a woman who was talking about something, and then somebody butted it and said, "Oh, I don't know why you're allowing people to be giving your child a label here, that this is wrong, that there's nothing wrong with the child, that everyone who moved from Nigeria or Africa to the UK, immediately they come, they're giving them diagnoses." So I had to come in. I had to come in, and I said, "Could you stop? You know, that person who is sharing her story is carrying a lot. You don't have to, put your derogatory statement here and make the person feel worse. That, excuse me, I'm a pediatrician from Nigeria who lived and worked in Nigeria, who saw children with neurodevelopmental condition living in Nigeria who've never crossed the border. So there is neurodevelopmental disorders in Nigeria. And what you should do is support people with positive language and encourage them and not something derogatory." I had to put it out there. And actually, I
That's
was
good.
surprised that there was a lot of positive response to what I said. But this is where we need to be out there. We need to be talking about it, because unfortunately, our religious settings haven't made things better. I don't know whether you can touch on that with faith communities, and what was your experience with the faith communities, the churches, the mosque, and how they approached neurodevelopmental condition.
I mean, traditionally, the faith communities have always believed that
Baby?
children have maybe like they are demon possessed, so they need to be delivered. So a lot of parents do take their children to churches and go for deliverance upon deliverance, and nothing really happened. But towards again in the last few years.
Yeah.
Okay, all right. So talking about faith communities and neurodisability, being initially traditionally most of the faith communities were they had this approach that it's a spiritual problem. Children needs to be delivered. Maybe they are demon possessed. Maybe it's witchcraft. Because we come from a very deep religious background. Even common things like epilepsy, people still believe is something that needs to be cast out of them and all that. But in the last few years, I think there's been a little bit of shift, and we actually have seen churches that are now more interested in neurodiversity. So I've seen some of our champions for neurodiversity going to churches, doing like talks, helping the pastors understand. Some of them now have sections in the children church for, understanding that children with, for example, on the spectrum, they may find the noise in the church too much. So they are beginning to accommodate all of that. There are not so many churches doing that, but at least I've seen a couple, and I've seen some of them actually taking the children to like the CP center, make donations. So they are beginning to accept. We are beginning to understand neuro disabilities. We are beginning to accept it. Now, churches now that these days when they are doing the program, you see somebody using sign language to translate as well. I see the faith church, the communities, they are moving better away from the old approach of thinking it is demonic attack that has to be dealt with and all that, they are now beginning to be more accepting. I think it's a reflection of the general society anyway, but obviously we're still not where we should be.
Society. Okay. And like you said, social media has helped a lot because people
Exactly.
are
Yeah.
saying things. So do you think we're doing enough on our own local media? Because I've said that to somebody. There was somebody that interviewed me recently on a podcast, and I said to them, we need to be using all forms of the media in Nigeria. And I don't think, because for someone who I listen to quite a bit of Nigerian media regularly, I don't think we're doing enough. I think there needs to be segments for discussing things like neurodevelopmental, child development, or child related issues. What do you think? What's your take on that?
Definitely, I agree. We can do more. Some of us are on social media. That's one of the reasons I am on social media doing all that. And I talk a lot about it. And I write also for some of the papers. I've written about autism and some of those things in the papers. But I think in terms of the mainstream media, TV and all that, I think I've done something for cerebral palsy on the mainstream with AIT or something. But it's something we need to do
Media.
more about. Yes, we can definitely do much, much better than what we're doing now, or have more people. I guess another thing is that sometimes in Nigeria, we're still dealing with a lot with even the basic physical health issues is still an issue for us. The malaria, the epilepsy, the conversions, the malnutrition. So a lot of people, health programs tend to focus on the physical health conditions more, but definitely we need to talk more about also neurodevelopment conditions.
Yeah. I think we need to because I remember once when I went to Abuja and I gave a talk even in one of the hospitals, I think it was Garki Hospital. And I was
Okay.
surprised the take on, and I was talking on epilepsy then, actually. I was talking on epilepsy and the management. And I remember even some of the doctors there were quite negative. They almost felt they were giving up, that there's nothing that can be done. And, in terms of certain treatments and stuff. And I felt that we need to be the ones being quite positive about, we
Mhm.
work in very resource limited areas, but we need to be positive and have a positive approach about getting this information out, giving it out, and educating people. I keep remembering when I was doing my training, where when I did that master's in public health, where I was going to communities, one of the questions I asked the families were, when your child had a seizure, did anybody talk to you about what to do and why this happened and how you can prevent a febrile seizure? And majority of them said no. And I knew that there was a problem with health education because people were coming to the hospital repeatedly. So something as small as health education, 5 minutes talk with somebody would have made a difference there. And that's why I feel that public awareness, teaching the schools, the teachers, the schools, the community, use every forum that we
Yeah.
can. And just for our audience listening, I hope this is inspiring somebody somewhere to say, we can do more. And we've heard the story, Gbemi's story of how much she impacted the the children just by there were obstacles, there were barriers, and she did not give up. The easiest thing would have been, oh, there's nothing to work with. But she came in, she was determined because she had seen where things work. She could see that children's outcomes could be better if things were done earlier. She trained professionals, she made up tools to help with developmental screening. She tried to look for interventions. So I I hope that the message is coming out to our audience is not to give up, not to give up. We are working in resource limited areas, and Gbemi and I are working in the UK here. It's not perfect. We don't get everything we want. We still don't have children having enough speech therapy, enough physiotherapy, enough occupational therapy. So things are rationed even here because the resources are not the way we think it should be. And we're still having difficulties. And just to say that even though we're in the UK, there's still people who are resistant to accepting, that their child may be neurodivergent in our communities. So the fact that they've moved from Nigeria to the UK or the US or wherever does not change that perception, because they
Mhm.
would still hold on to those beliefs because they're in a community. So even if they were thinking, okay, I'm listening to what this doctor is saying, they're going back home, their parents are there, their relatives are there, their pastors are there, their imams are there, and people telling them no, no, no. So that's why we need education of the whole community. The whole
Mhm.
community, the whole unit needs to be involved in, improving awareness. We need to do that. And maybe you've been doing a lot. Thank you so much, because I'm so pleased to hear that you've been doing a lot with the media, going in, talking to them, doing all those things with them, because you have been spreading the message in the communities. One thing I always say is that as clinicians, we need to move out of the clinic rooms. One of the things I enjoyed when I did public health was the ability to look beyond just the clinic room. And that's why I one of the driving forces for me setting up early intervention matters was I took things I'd learned during my public health masters, and I said to myself, actually, I, education of public awareness is such a big thing. Now, as
Exactly.
pediatricians, we need to move out of the clinic room. We need to engage with the public. We need to understand people's fears. What is the reason that they are worried about? Because you can only change attitudes when you engage with people. So thank you so much for continuing to do that and you've laid those grounds. And I hope there are people still carrying that on, even though you are not there. I want to
Yeah.
believe there are people carrying that on. How are you engaging and overseeing? Because you did a lot. And I don't want to see those things, those good things that you did, just go away. So how are you ensuring that those things, those good seeds that you sowed, are still going on?
Yeah, so one of the things I was able to do while I was there is I have some residents working with me also who are interested in developmental pediatrics. So some of them did their dissertation and things around that area. So I was, even when I left to the UK, I was still supporting them. And then I was doing like MDT discussions with them. So when they see children, they discuss with me, if they need my input. But at least they know how to do assessment. I've trained them before I could leave. Just the sad news for me is that the Japa syndrome has affected most of the people I trained as well. Because, the whole thing is not in an isolation, it's the whole Nigerian setup. So a lot of our doctors have left as well. So some of them are also have left now. But I see I'm in conversation with my colleagues who are saying Nigeria in terms of how can we train. In fact, even today I was still having a conversation with one of our pediatricians who is also now interested in developmental pediatrics, and I was telling her about how she can get either training in South Africa or even the Sheffield program on pediatric neurodisability, which is virtual. She doesn't have to come to the UK for that. I'm still trying to link people up. Then I still provide support to a lot of pediatricians who I see in Nigeria, who are still working with children in the general hospitals and all that. So I do a little bit in that respect. I really wish where we can do more. Wish we can have more people also still working with the children, but it's just the general situation in the country that is
Yeah,
obviously affecting the health sector generally. All the
yeah,
doctors, not just
yeah.
those of us pediatrics or those of us in developmental pediatrics is the whole ecosystem.
It's
Generally,
true.
our it needs a lot of intervention, but we want to go into all that. I'm always available for people to discuss with. I'm always available to
Yeah,
support and do training. So that's what we do. You were part of our training
yeah,
for the conference that we did. And I'm happy, like people like Professor Lagunju in Ibadan. So Lagos State actually has developed their own developmental screening, which is part of their own, what we call Red Book here, which is part of their immunization card. So they have a whole book. So when children
okay,
go for immunization, the nurses can actually do their developmental surveillance.
yeah,
So even when I was in Lagos, we were training the nurses on how to do surveillance again. So apart from the the doctors, we're also training the nurses on developmental surveillance. Like you said, they see the children for immunization, for growth monitoring. So they may as well just check that, oh, are you crawling?
Exactly.
Basic screening, basic surveillance. So, and I think
Exactly.
from what Professor Ladwinji was saying, they've also developed one, and I'm hoping they can integrate it into the green immunization card, so it will go national, and all our children, when they go for each of the immunization, they can be they can have some form of developmental surveillance. So I'm not sure whether that has picked off, but we still have a few professionals in Nigeria who are still doing a lot of work. But it's a big country. Definitely, we need
It's a big
more.
country, and it just
Yeah, we
needs to
need
roll
more.
out to the community.
Exactly.
Because I think what I worry about is when things become too centralized,
Yeah.
and it's not reaching the people down there in the community where they need to, because the woman in the village with her children has nobody to come there to see her, and so that's the thing that we need to look at. So now having a bit of a positive spill to it, we've had technology coming, to help change things, in the sense that people now have access to seeing what is happening. So how do you think, in what ways has technology benefited the neurodevelopmental management of children?
Yeah, I think it's in so many ways. So even starting from screening, like I said, some of the parents now, usually like from our group, for example, Ask The Paediatricians, parents are comfortable to ask us questions about anything about their children that is not, they don't understand. So I always tell them, I don't believe there's any foolish questions. So ask. Of course, I get a lot of questions from just anxious first-time mothers, and we just reassure them. I'm so happy they can ask, and then somebody can reassure them. That is normal. You don't need to worry. But also in that platform, you now get people asking, my child is not yet talking about 2 years, so what do I do? So we have like, okay, these are the speech milestones, these are the things you look out for. So parents know where to do, and a lot of them even know how to just go and search for themselves and get the answers. So that is a positive one. We also have apps. So for example, anytime people send me a question about, suggestive of like when you were introducing those kind of classic of early signs, we tell them to go and do the MCHAT screening, which they can do online, and they get their own answer straight away. And so they know whether, you need to see a pediatrician for, further assessment.
Good.
So I think technology is quite good, and a lot of teaching on YouTube now. I always tell parents, which is one of the things I tell Nigerians, because I see intervene a lot with Nigeria, even though I'm in the UK. You have to be your child's therapist. We don't have the
Yes.
therapist. Or you are your child's number one therapist.
Yeah.
YouTube is a very lovely thing. A lot of speech therapists have put their therapy sessions on YouTube, so parents can watch it and do therapies. And for parents who can afford it, sometimes I link them up with therapists who are willing to do virtual
Online.
with their children. Yes, so some of my colleagues in South Africa, who like in the private sector, some parents actually link up with them, and they will set up a program for their child, tell them this is the
Very
program.
good.
Sometimes they even train. Nigeria, one thing we have is people. We have abundance of human resources. So you can get somebody who can be like maybe somebody who just have a secondary school or a basic.
Absolutely.
Yeah, and some of them are willing to learn, so they can teach
Yes.
them the basic thing. But the main therapists, maybe in South Africa, in US, or wherever,
Absolutely.
can set up the program
I
and
mean,
say that
these
this is
days the
what you
world
do.
is virtual. The world is virtual
Exactly.
now. So that's why I'm saying that I'm so pleased that,
Yeah.
that these things are now reaching families. I
Exactly.
think we need to think about the people in the rural area. We need to
Yeah.
think about those ones where when they have children with developmental difficulties, where do they
Yeah.
go? What do they do? How can they
Yeah.
access that care? We need to
Yeah.
think about the ones that are in remote areas and ones that are not. Because what tends to happen in Nigeria is that you have a place which is upcoming and things are happening, and then some of the other areas, things are not really reaching them. So that in order
Yeah.
to be something that's really spread out, we need to think through those areas. So I'm really pleased that you're continuing to engage, you're continuing to do those things, because we need to, I keep saying it as something that we need to give back to that society that's given us quite a lot, but also for those families who can't reach out or get those things. And that's why I'm really happy with what we're doing.
Yeah.
And even for families, Nigerian families in the diaspora, in the UK, US, Canada, if you have relatives back home and you see, you notice differences in the child, what would you say to such families? Because there's so many now that I'm sure if you speak to every other person here, they would know one person with a child with neurodevelopmental disorders. So how
Yeah.
can they help? How can they support? How can they help?
So just to add to what we're saying about children in hard to reach places, some of those people doing some of this work now do outreaches. So we actually do outreaches in the rural areas, and then we can obviously we outreaches usually maybe once in every few months. So it's not all the time, but that's how we reach some of them. And for those who know, I think for those here who are more aware, sometimes they do reach out to their family members that they know and they recommend that can you get your child assessed and all that. So I think a lot of family are seeking support, and sometimes some of these foundations, they do some outreaches from time to time. And one of the things we normally do, that when we know there's going to be an outreach, we kind of publicize it and let them know they're going to be an assessment, an outreach here. Can you bring your children down? And so people do go for them. So those are some ways by which we're all supporting each other. But generally, I think the awareness is better. I think people now know that they can get help if they, and finance is still a major issue, but at least the awareness is there and people make do with what they have in terms of getting the support that they need for their child or their relatives.
I think you've given me a lot of hope that there's. I think the conversation is giving me hope that there are things that are
there is
changing.
hope.
So what is your advice for a family listening now? So that mother that I read at the beginning whose 2-year-old child who isn't speaking, doesn't respond, she's in this conflict, she's getting all these mixed messages. Her mother is telling her that your child needs prayers. Her pastor is saying there's a spirit in the child. And then she even goes to a clinic and they tell her, no, he's a boy. He'll talk when he's ready. What is your advice for this mother?
So, my advice, I mean, and this story you just gave is actually a very typical story. Actually, when I was almost thinking, I read it from my article on my website because that's actually the way I wrote this story. So,
Really?
yes, it is. My advice is that they need to seek help from the right specialist, and usually that's the pediatrician. I always separate. I don't have any problem with you praying and with your pastor praying, but you can always do the two at the same time. You can get the right help. And like the title of this podcast, early intervention matters. The earlier we make a diagnosis, the earlier we support the child. And I always tell them the fact that you worry, because I think that's the fear. Are they going to label my child with something? I said, sometimes we're not going to give you any label. Sometimes there may be nothing, but I would rather err on the side of caution. Oh, it's just a little bit of speech delay. The child is just slowly catching up. We have not lost anything intervening in a child who eventually, maybe it was just a little bit slower talking and then the child catches up. But if it is something more and we have lost those early period where I always tell them about the brain being plastic, the first 5 years of the brain is still of the child, the brain is still developing. Anything we do at that time really, really matters. So I always want that mom to go for that help, and there is help. Even online, you just put it and search, you will come, this will come back to you. These days we have AI, we have everything telling us
Yeah,
what we can do.
exactly.
And then you can always search for who is
Yeah.
the professional next to me who can help me. And you get that information. Yeah, that's so don't just sit and wait and hope things are going to improve. Let's help. Even if at the end of the day the pediatrician is going to reassure you, but at least get a professional opinion first. Don't assume or don't just hope things will just improve on their own.
I think you have made a very key point, and parents listening out there, the audience, as Dr. Boyede has said, don't just sit down, get help. I've had numerous times where people have reached out to me and said, the child is not talking and all that. They're just watching and waiting. They're noticing certain things. They're just waiting because they're getting all this conflicting information from. I think it's always better, and Dr. Boyede has explained about the brain development and the key period where it's so important to act at that time. Dr. Boyede has explained that beautifully. The key message is, please, if you notice any difference or that your child is not developing as expected and you are worried, don't, you're hearing conflicting messages. It's always better to get help than to just sit down. And she said, there's nothing wrong with prayers. We all believe in prayers in one form or the other. Please, you can pray and do and seek that help at the same time. It doesn't stop one from the other. And what is your message to clinicians, to pediatricians? So I've, I've written a book about my journey,
Oh,
and it will be coming out soon. It's titled From Clinic to Calling, how I moved from, general pediatrics and neurology, and I had this deep seeking for doing neurodevelopmental peds. And it's a bit, it's again taking one through the journey of how I accessed that, what challenges I was facing initially, how I navigated that, and, up to where I am and the things I've done. And it's just like, I felt it was important to put that down because it gives hope to people that you will face barriers. And I was so glad not glad, but it was interesting to hear your story with all the
mm,
barriers you faced, about how you
mm,
overcame it. And you overcame it because you were determined to seek good care for
mhm,
for the children. And those things that you did has made an impact. You are not there, but that impact is still there. Your voice is still there. You're still supporting people across the pond. And that's what we want to say, that, so I've written those memoirs down as a hope, and that a pediatrician somewhere will see that and be able to say, actually, I can overcome this and all that. It's a journey we're all on. We learn more about the children the more we work with them. And the more we get to see the children, the more we work with them, the more we know them, the more we get better. It's good to
mhm.
listen to families. It's good to listen to the children. It's good to watch and see. But once you've got the passion for, supporting the children, you will sail through. So I just want to encourage young clinicians. And Bimi, what do you want to add to this?
I think you've said it all, to be honest. I think it's about the passion. Yes, you also have the passion. I think the opportunity, you will recognize the opportunity when it comes, because I'm just thinking back, like when the developmental pediatrics training opportunity comes, and because I already have that interest. So that's why I was able to recognize it and I was able to go for my
Yes.
training. So,
Yeah.
like, just like you said, just be interested in being better for our children and helping our
Yeah.
children. And usually, opportunity will always come. And these days we have technology, so you can be anywhere in the world and you can get resource people. Somehow, even like I know that BPNA, for example, they organize all this training that you can do virtually. There's so much opportunities, and for those of us from, I know Nigeria, typically we should not be called third world, but for those of us from low income, low resource countries, they offer some of these things almost for free. So, and lots of associations also offering all this training.
Mm,
So I would just say that for our clinicians in places where they don't have resources, they should use online resources to start training themselves. And then, like you said, apply it. Sometimes it's all about low cost technology. We may not have all the beautiful
yeah.
resources in the first world, but like you say, even in the NHS, everything is not perfect. But even with what we have, we can do a lot. And that is one thing I learned in my early years of my developmental pediatric training. I have to adapt a lot. I have to create my own tools, and it works. And the most important thing is that we're helping. So
Yes.
don't give up. Just keep doing what you can. Yes.
And what you said is what I say to people is that, I used to take the tools with me to Ibadan and I
Yeah.
used to tell the students, I'm only bringing this to show you what is
Mm-hmm.
used, but this does not, there's so many ways you can
Mm-hmm.
assess whether a child's fine motor skills are good,
Mm-hmm.
whether a child's gross motor skills are good, what they're doing. You don't need
Mm-hmm.
these fancy tools to be able to pick up that a child is delayed in their motor
Mm-hmm.
development or their fine motor. We need to be more versatile to our community using
Mm-hmm.
culturally appropriate tools to assess our community. And that's what I'm very keen on. I remember the students used to be like, oh, Dr. Takon, we want to. I said, no, 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 this, why are you showing them this pictures that they have no clue about? Show them pictures of familiar things that they know, things that are familiar to them, and
Mm-hmm.
you're still assessing the same development in the child. So, and your final message for the government, because I'm sure somebody in government will be listening to us, and I want somebody in government to listen to us because this is beyond just, thinking, we can just keep doing business as usual.
I know.
We need the government to be responsible. I'll let you talk on this, Bimi.
Yeah, thank you. Yeah, the government definitely should be listening to us. And I'm happy the government have started what they call the disability bill or something like that. But like as always, when governments are making their decisions, is the adults in the room? I don't think our children are ever represented. So I see them doing a lot of things for the adults with neuro disabilities or disabilities like visual, hearing, and all that. Our children are more important because they are going to be the future of the country. So I really want the government. We don't have special schools. It was so heartbreaking. I was doing a lot of outreach. I do outreaches with some of these foundations. So I was doing online consultation for them for some of the children with cerebral palsy, very severe disabilities. The parent were like, even the special school they go to, the children are just there to wind away the time and then they come home.
Yes.
No therapy, nothing. So you
Yes.
can see the mother, the pain. So I'm hoping Nigerian government should at least give this, provide basic resources, the
Yes.
special schools, the wheelchair. Parents are having to pay. Thank God for the foundation sometimes will give them. These are basic things that can make a difference. The fact that that child can even participate in the community because these children are now 15. The mothers can't carry them anymore, but they don't have a wheelchair.
Yes.
Okay, and that's physical disability. Or what about our children with autism, no speech therapy, nothing? We don't even have training schools. So these are the things the government should be doing. The world is becoming a global village. They can see what is happening in other places. And I hope they are, when we're planning, the government thinks about children with neurodivergent conditions, children with neuro disabilities, and plan on what is the long-term plan. How are we even going to get the professionals for we do? How are we going to get the resources? Some of them are not so expensive. It's just the fact that we're not even thinking about them. If you think about them, we will
Yeah.
make these resources available. So I hope the Nigerian government will begin to think more. And I hope we have somebody who will be a voice for our children in the Senate or when they are talking about disability. It's not only adults, our children also have disabilities, and it's
Yes.
important that their needs are also addressed. Thank you.
Wow, this has been a very rich conversation with you, baby, Dr.
Yeah.
Boyede. It has been an absolutely enriching conversation. First of all, from just saying that we've come from very similar paths, we've had similar desires to do developmental pediatrics. We've sought for the opportunities and gone out and trained to make ourselves better. We've continued to, and you went back and you did a lot. You reached out, you established services, adaptive technology, you engage with people outside, even when the shutters were down, you tried to find a way. It's just amazing. And you've left me with so much hope Actually, you've left me with so much hope and positivity that things can really get better. And thank you for sowing those shoots. Thank you for continuing to water those shoots. And there's still a lot of work to be done. And that's why you and I continue to be champions of neurodisability, because we want it to be an equitable place where the fact that you are in Africa, you're in the rural area, wherever you are, is not a barrier to you being getting care. And as we say, the earlier the children are identified and the earlier they get the interventions, the better it is for them. So thank you so much for all that you do. And how can people find you? How can guests find you?
Yeah, so on social media, I'm online, I'm on Facebook as Gbemisola Boyede is still my name on Facebook, but Ask The Paediatricians Foundation is my where I do a lot of the support for pediatrics and answering questions and all that. I'm on Instagram, the same name. Everything is my name. I'm on Twitter. And then we have our website, www.askthepaediatricians.com. And we also have a podcast, Ask Dr. Gbemi ATP podcast. So I think with all those platforms, yeah. And of course, I'm on YouTube as well. ATP TV, that's our YouTube channel. So, yeah.
Oh, that's fantastic. And I'm really pleased. We will put all these details in the show notes as well. So we're really pleased. So thank you so much for contributing to our session. As we said, this is Early Intervention Matters podcast. We do come up on, we do have publish our podcast online and on different platforms as well. And we've created a section because of the questions that come in for developmental pediatrics, mainly on the Substack publications for Ask the Developmental Pediatrician. Questions is mainly for families to contribute their questions, sometimes from the episodes, which we would then answer. We also have a YouTube channel at Early Intervention Matters, where we mainly publish, we use it mainly for publishing our podcasts and for families who want to ask questions there. So Dr. Boyede, thank you so much for contributing to our session. We're really grateful that you could spend this time with us. We look forward to having you back in future. We look forward to continue to hear the good news. And as I said before, we do, we share the same vision. So it would be good to see some collaborative working together with yourself and the good work that you're doing. Thank you.
Thank you so much for having me. I've also been inspired by what you do, and I hope I can also do more as well. Thank you.
You're doing a great job. Thank you. Thank you. As we always say, early intervention leads to better outcome. And early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.